I think putting together a talk for a session on management of fit adults who are suitable for intensive treatment following diagnosis has just emphasised how massively the landscape has changed over the last 6 or 7 years since we put together the last big group of national cooperative studies. There's been this huge explosion of new drugs that have been approved for management of fit adults, which can now be combined with intensive chemotherapy, and it's led to a big shift in the treatment algorithms. So we've got FLT3 inhibitor drugs, we've got immunoconjugates like Myeloid, we've also got, for the first time, approved maintenance therapy with the oral hypermethylating agent, and new ways of delivering chemotherapy like Vyxeos. So the big challenge, I think, has been trying to work out ways that we can develop the treatment algorithms to bring all these approaches together for management of patients, but also it's created big challenges for how we organise clinical trials going forward, because the standard of care is very different for different subpopulations of patients, so we've had to be quite imaginative going forward. I think the other thing that's emerging now are some really important data from the last generation of cooperative trials like AML 18 and 19, and I think one of the sort of big finding that's emerging from that is that FLAG-IDA Myeloid chemotherapy seems to be emerging as a standard of care treatment for patients with NPM1-mutated disease, and that's something that will probably form the backbone of management of those patients going forward. What I'm also going to present is some of our thinking about strategies for cooperative studies going forward in the UK, and hopefully we can maintain enthusiasm across the large number of trial centres that have traditionally helped make those sorts of studies such a strength.